Hi, I am Dr. Vybhav Deraje. I am a consultant craniofacial and plastic surgeon, Bangalore. Cranial vault remodeling or fronto-orbital advancement are the two procedures which are required as an open approach to treat children with craniosynostosis. Whenever we are not able to do the minimally invasive approach of endoscopic strip craniectomy and helmet therapy, and when a child presents to us after 6 months of age, so we offer this cranial vault remodeling or fronto-orbital advancement depending upon the diagnosis. Now for example, the metopic synostosis babies and unicoronal synostosis babies require something called as a fronto-orbital advancement, which we'll be speaking. And children with sagittal craniosynostosis, where there is a fusion of this big suture in the middle of the head, that causes scaphocephaly, and that requires something called as a cranial vault remodeling. Now in cranial vault remodeling, what we do is we make a cut from one ear to the other. A zigzag cut is made so that the scar is not visible later on, and we peel the skin off. After peeling the skin, we take the bones which are deformed, we take it out with the help of a neurosurgeon. The neurosurgeon protects the brain during the procedure. These abnormal shaped bones are taken off, reshaped, and then fixed back using resorbable plates and screws, and sometimes even sutures and stainless steel wires. Now when we put this back, the abnormal shaped head is converted into a more normal shaped head. And once the bones are put back into position, the skin is put back in and absorbable stitches are made to close the wound. Now usually these babies stay with us at least for a week in the hospital. There will be a lot of swelling after the surgery. Usually 2 to 3 days at least there will be a lot of swelling, and the eyes might close after the surgery, causing some anxiety for the child. We encourage the parents to be with the baby all the time so that the baby is really comfortable, and the presence of parents is actually the best painkiller for the babies. Now these babies usually require at least one blood transfusion because of the complexity of the surgery and the amount of blood loss that happens. These babies also require one night stay in the ICU for observation, and once the baby stabilizes, we shift them back to the ward. Usually our babies are discharged on the 5th to 7th day after admission, after the surgery, and then we follow them up after 1 week. Now this is a process called as cranial vault remodeling. Now in cranial vault remodeling, age is crucial. If we do the surgery very early, as I explained, it's a massive surgery, so it can be a big risk for the child. If we do the surgery very late, the bones become very hard and it becomes very difficult to remodel or remold the bones. So our preference has always been to do the cranial vault remodeling or the fronto-orbital advancement at around the 9 months of age, where the bones are perfect for remodeling, and also the babies are big enough to sustain this procedure.